Welcome back to Smart Wellness Tips, your trusted guide for healthy living. Today, we explore the changing dynamics of blood pressure. Have you ever wondered why your doctor focuses on different numbers as you age? The answer lies deep within your arteries. Blood pressure is not just a simple pair of numbers. It is a vital indicator of your cardiovascular system's true health. For younger individuals, doctors often pay close attention to the bottom number, known as the diastolic pressure, for heart health. However, as we cross the threshold of 60, a significant physiological shift occurs that changes how we must view these readings. The top number, or systolic pressure, measures the force your heart exerts on artery walls each time it beats and pumps. The bottom number, diastolic pressure, indicates the pressure in your arteries when your heart rests between beats and fills with blood. Understanding this mechanism is crucial because the rules of the game change dramatically as our bodies naturally age over time. In our youth, our arteries are like fresh rubber bands, stretching easily to accommodate blood flow without raising pressure too high. But as we age, these vessels lose that essential elasticity, becoming stiffer and acting more like rigid pipes than flexible tubes. This stiffening causes the top number to rise significantly, making systolic pressure the most critical predictor of health risks after 60. Ignoring a high top number in older age is dangerous, as it directly links to higher risks of stroke and death. Many patients are misled by outdated advice, believing that simply having a low bottom number means they are completely safe today. There is a pervasive myth that having blood pressure around 140 or 150 is normal for seniors. Experts like Dr. Harrison warn us that levels above 140 already start to significantly increase your risk of stroke. Your brain's delicate blood vessels cannot withstand this constant high pressure, regardless of what you consider normal for your age group. So, if you see readings consistently reaching 150, do not assume it is just a natural part of aging. However, treating high blood pressure in older adults requires a delicate balance that is often overlooked by standard medical protocols. The challenge lies in lowering the top number without driving the bottom number down to dangerous levels that compromise your health. Your heart muscle receives its own blood supply primarily when it is relaxing, which depends entirely on that bottom pressure number. If aggressive treatment pushes your diastolic pressure below 60, your heart may not receive enough oxygenated blood to function correctly. This lack of perfusion often leads to severe dizziness, confusing brain fog, and a feeling of constant fatigue throughout the day. These symptoms are not just annoying. They are warning signs that your brain and heart are being starved of vital blood. The most immediate danger from overmedication is falling, which can lead to hip fractures and other life-altering injuries for seniors. Therefore, the goal is not just to crush the top number, but to find a safe zone for both readings. This brings us to a crucial concept called pulse pressure, which is simply the difference between your top and bottom numbers. For example, if your reading is 150 over 70, your pulse pressure is 80, which is considered quite wide. A wide gap indicates that your arteries have become very stiff, acting like rigid pipes that hammer your organs with pressure. Even if your bottom number looks perfect, a wide gap is a strong, independent predictor of heart attacks and cardiovascular disease. Doctors use this pulse pressure to assess the true age of your vascular system and the stiffness of your major arteries. The good news is that you can improve arterial health and manage these numbers without relying solely on heavy pharmaceutical interventions. Let us explore effective non-drug methods, starting with the most powerful tool available to everyone: gentle, consistent, daily physical movement. You do not need to run marathons. Walking for just 20 to 30 minutes a day can work wonders for you. This movement stimulates the lining of your blood vessels to release nitric oxide, a natural gas that relaxes tight arteries. Regular walking helps restore some elasticity to your blood vessels, effectively lowering that stubborn top number safely and naturally over time. Avoid high-intensity workouts that spike your adrenaline too much if you are just starting, as this can temporarily raise pressure. Focus on rhythmic, aerobic activities like walking, swimming, or cycling that keep your heart rate up but manageable and comfortable. Diet plays a massive role, but the advice is often more nuanced than simply cutting out every single grain of salt. Eliminating salt completely can be dangerous for seniors, potentially leading to dizziness, electrolyte imbalances, and an increased risk of falls. The real enemy is not the salt shaker on your table, but the hidden sodium found in processed and packaged foods. Read labels carefully. These industrial foods contain massive amounts of sodium that stiffen your arteries and spike your blood pressure. Instead, eat fresh, whole foods, and use salt in moderation to make them palatable, ensuring you maintain a healthy appetite. Hydration is another often ignored factor. As we age, our sense of thirst diminishes, leading to chronic, low-level dehydration. When you are dehydrated, your blood becomes thicker and more viscous, requiring your heart to pump harder to push it through. Drinking enough water helps thin the blood naturally, making it easier for your heart to pump and lowering systolic pressure. Finally, never underestimate the power of a good night's sleep in regulating your body's stress hormones and cardiovascular health. Deep sleep reduces adrenaline and cortisol levels, allowing your blood vessels to relax and your blood pressure to reset naturally. Poor sleep keeps your system in a state of high alert, preventing the nocturnal dip in pressure that protects your heart. By combining these simple elements, movement, diet, hydration, and sleep, you create a powerful synergy that supports your aging arteries. Remember, the goal is not to chase a perfect number from a textbook, but to achieve the best health for you. Managing your blood pressure effectively means preserving your vitality, your independence, and your ability to enjoy precious moments with loved ones. Listen to your body, work with your doctor to find the right balance, and never ignore the signs it gives you. Tracking your numbers at home gives you a clearer picture than a single visit to the doctor's office ever could. Don't let the fear of numbers control your life. Instead, use them as a tool to guide your daily wellness choices. Your body has an incredible capacity to heal and adapt, provided you give it the right environment and care it needs. Start small today. Drink an extra glass of water, take a short walk, and prioritize getting to bed on time. Stress management is also key. Chronic stress tightens arteries just as much as salt or age, so find time to breathe. To recap, watch the top number, protect the bottom number from dropping too low, and mind the gap between them. Consult your healthcare provider before making drastic changes, especially if you are currently taking medication for your blood pressure regulation. Explore different ways to move that bring you joy. If you enjoy the activity, you are more likely to continue. Incorporate heart-healthy fats like olive oil and nuts into your diet to further support the flexibility of your blood vessels. Limiting alcohol intake is also wise, as alcohol can stiffen arteries and raise blood pressure significantly when consumed in excess. Every day is a new opportunity to make better choices for your heart. It is never too late to start improving. Joy and connection release hormones that counteract stress. Keep your heart happy emotionally, and it will be healthier physically too. Visualize your arteries becoming clearer and more flexible with every healthy step you take and every healthy meal you eat. Knowledge is power. Sharing this information with friends and family could help save a life or improve someone's quality of living. We believe that aging should be a journey of continued wellness, not a gradual decline into sickness and frailty. At Smart Wellness Tips, we are committed to bringing you the most practical, science-backed advice for your golden years. If you found this video helpful, please hit the like button so we can reach more people who need this. Leave a comment below sharing your own experiences with blood pressure management. We love hearing from our Smart Wellness community. Stay tuned for our next video, where we will dive even deeper into specific foods that naturally unclog your arteries. Your health is your most valuable asset. Protect it with knowledge, nurture it with care, and respect it with action. Keep moving, eat wisely, stay hydrated, and sleep well. These are the 4 pillars of a strong and healthy heart. Thank you for trusting us with your time today. We hope this guide empowers you to take charge of your health. Thank you for watching Smart Wellness Tips. Subscribe for more life-saving health advice and take control of your blood pressure today.